What's the largest healthcare IT company in the entire world? It's Optum. And in 2016, it brought in a whopping $83 billion from healthcare services. Here's a health services and innovation company whose strategy includes partnering across the entire health system, and they're connected with over 100 million Americans. Today, I speak with seasoned healthcare veteran and executive vice president at Optum, Dr. Mitch Morris. We're talking with the biggest of the big boys right here on Red Hot Healthcare. Let's go.
This is Red Hot Healthcare. Interviews with today's leaders and all the news that matters. Here's your host, Steve Ambrose.
Hello and great to have you aboard. I'm your host, Dr. Steve Ambrose. For past and upcoming episodes, find us on iTunes and most podcast directories, or on our eye-catching website, redhothealthcare.com. Our guest today is Dr. Mitch Morris, Executive Vice President at Optum Insight. Mitch was a former Senior Vice President of Health Systems and CIO at Houston-based MD Anderson Cancer Center, where he was also a professor in gynecologic oncology and health services research. Carrying more than 30 years of healthcare experience in consulting, healthcare administration, research, technology, education, and clinical care. Mitch, an absolute privilege and pleasure to have you on. I've been looking forward to this. Welcome aboard Red Hot Healthcare.
Steve, delighted to be here and enjoy your work very much.
Okay, Mitch, let's jump right on in. And I know the audience is going to have just a terrific time listening to this here and get so much out of it. You've got an extensive background in healthcare. First through practice, then it was management. You did a whole bunch of consulting, and eventually you wound up on the big business side of healthcare. I'd like to know how your perspective has changed today in the way you view the health system and the different players involved.
Well, sure, Steve. And our view of the health system evolves the longer that we're in it. I think I've had a pretty unique opportunity to see it through different lenses. Originally, as a practicing physician, you see things in a particular way. Then as a hospital executive, you see things in another way as a consultant. And I worked with government, life sciences companies, payers, providers. I had a chance to walk in all of their shoes and see how they viewed the health system. So you really begin to get a sense of there's not one particular thing that's right or wrong in terms of approach. And as we try to frame the debate, and it's certainly being framed right now in Washington, or at least they attempt to do it, right, we really need to look at the entire pie of the healthcare system, not a slice of the pie. Really understand the complex interrelationships. And for reasons that are understandable, when it gets debated on television and even in printed media, it gets oversimplified to some degree, and people just look at it through their lens. I think as we look at it through a broader lens, that's much more helpful. So that's how my approach has changed. And probably the most important lens, we've all experienced this one, is looking at through being a patient at some point. And if people listening haven't been a patient, one of their loved ones has, and that's ultimately the view that's most important.
Mitch, I take your point completely, and it takes me back to a prior episode that I had with Joe Antos. Joe is a healthcare economist over at the American Enterprise Institute. He's on numerous TV shows, and he has his views on healthcare. But when I talked to Joe about looking at things from different perspectives, it really surprised me, especially when we go back to somebody like Donald Trump, when he started talking about healthcare and making his point that we're going to go ahead and we're going to sell healthcare across state lines. It's going to be a beautiful thing, and it's going to lower healthcare costs 60%. I mean, it's just going to be a beautiful thing. It's going to be wonderful. And not only was he so sure of himself, but the media bought it up. And it just really goes to show that there's so many people out there that really don't have, and a lot of them are very educated people, but they just don't have a real idea of how true healthcare economics and the interaction between the different industries in the health sector actually work.
It's absolutely true. And sometimes things are just incomprehensible. Let's face it. I don't think anyone totally understands global markets in terms of other industries and how economies go up and go down. They certainly have cycles and momentum. And
Yep.
healthcare certainly has complexities that are very difficult to understand because if you touch one part of the system, it has a reactive impact on other parts of the system.
Mm-hmm.
So I think we all struggle to really have a deep understanding.
Okay, so let's get into United Health Group. This is a managed healthcare company with two subsidiary operating businesses. You've got United Healthcare, which is the benefits side, and Optum, which is the health services side. And you're an executive vice president at Optum Insight, which is actually a division of Optum. I'd like you to give the audience an idea of what Optum Insight does and where the biggest focus is centered on in its immediate future.
Well, that's a great question, and it's funny when I meet people socially and they say what you do, and I say I work for Optum. And they go, "What does Optum do?" And if I give them the full answer, they glaze over after about 30 seconds. And it is a big and complex company, but here's an easy way to think of it. There's really three main areas. One is Optum Rx, and Optum Rx is pharmacy care services, pharmacy benefits management, and that's a significant part of the company.
Yep.
Another part of Optum is Optum Health, and that includes our provider business, which is primarily focused on the ambulatory care space, and we can talk a little bit more about that later, but also involves a variety of managed services for medical practices and hospitals around care management and population health and things like that. And then the third is Optum Insight, the part that I live in, which is a part of the organization that enables many aspects of the health system. It involves technology, very, very large data, analytics, understanding finances, outcomes, how well people do, and really works to improve the system. And we also have a advisory services group with consulting activities that help our clients navigate the health system and understand the kinds of things that Optum can deliver to them.
Yeah, and we're going to go ahead and get into that, particularly the advising side of Optum, a little bit later in the show. You're growing into that space. It's very, very important. I want to cut over to Larry Renfro, the CEO of Optum. I went on the website and read a quote of his, and it stated the following. I'll go verbatim here. Quote, "Our goal is to make healthcare simpler and work better, most significantly on a human level." So, Mitch, right now, I can't think of a more complicated industry. I think it has the least chance for sustainability the way it sits right now. I'd like to know how Optum, the parent of Optum Insight, is looking to make healthcare simpler and work better.
Yep, that's a great question because that's certainly an aspirational statement on the part of Larry, and we have a number of different initiatives that work towards this, but we tried to think of what's a unifying statement for the things that we do, and it's making healthcare simpler because you're right, it's way too complex, and function better for everybody who's involved in it. So I'll give you a few examples of how we do it. I'll start with people, whether you call them consumers, patients, et cetera, but I call them people. How do they navigate through the system to achieve good health? And you don't have to necessarily be sick to do that. You can maybe want to shed a few pounds or stop smoking or have healthy behaviors, make sure you're getting screened for things properly. So we have an application called Rally Health that's been very well accepted that is interactive, works on smartphones and tablets, and helps people take more charge of their own health. And many large employers, for example, attach incentives, financial incentives to their employees who use Rally Health, including screening for things, encouraging them to work together through social media to, for example, lose weight, encouraging them to go to the physician and get biometrics done and check on their health.
Mm-hmm.
So that's one, and it's easy to use, it's simple, and most people who use it find it enabling, helps them keep track of their own personal goals and health. Another example, and we hear Secretary Price talk about this one, is how do we make life simpler for physicians? And certainly physician burnout is an issue. You see more and more physicians who, and their staff who say, gee whiz, I thought I was doing this to take care of patients, and now I'm spending all my time dealing with insurance companies and so forth.
Yep.
So again, this is one where using technology can help make lives a little bit simpler for them. An example is real-time claims adjudication, so you can understand who's eligible for what when you're thinking of it and not waiting for a process that goes on paper and takes a month or so, by which point maybe it's not even relevant anymore. Another way for both patients and doctors and their organizations is understanding what the financial obligations are of somebody when they come into the physician's office.
Yes.
Up front, I recently was drinking a little too much coffee and had some palpitations, and I stopped drinking coffee and I'm fine. But my cardiologist said, "Hey, why don't you get a stress test?" So I went, and I knew I hadn't done my deductible at all, and it was $2,500, and I figured that's probably what a stress test costs. But when I asked the person at the health system, that shall go nameless, how much is my responsibility, the person tapped on the computer and said, "I'm not really sure."
Wow.
Well, I went ahead and had the stress test. Everything came out fine. But the point is, the average American can't afford a bill of $2,500, which is what I got. They run the risk of having their credit ruined, having to sacrifice other things in life.
You bet.
What if you knew about all that stuff up front and could work out a payment plan in advance? Or maybe there were some alternative tests to do, all kinds of things that are possible. So that's an aspect of making things simpler. You might ask me a little bit later about the advisory board company, which we've announced an agreement to acquire. And they bring some amazing talent around making EHRs simpler. Doctors complain about, "Hey, I'm not spending enough time with my patients. I wish I had a higher quality interaction with them, but I have to put everything into the computer." They work with electronic health records and physicians and health systems on making that process simpler and work better for doctors and for patients.
Yeah, I think that's going to be a real smart acquisition. And I like a lot of the things you're talking about with the EHR too, Mitch. I can tell you that I had John Glaser on my show from Cerner not too long ago, and he and I talked all about EHRs, the technology, and what he dubs some of the biggest issue with EHR, which is physician pajama time, which, as you know, is when doctors can't, unfortunately, finish their daily notes, and they have to, after dinner, then open up the laptop and finish notes from home. But I want to switch gears here. You've been on record, Mitch, for being an outspoken advocate for telehealth. I recently came back from a telehealth event that I keynoted up in Silicon Valley. I think, too, there's a lot to be excited about. I'd like to see if you can give our audience a little perspective on where you see the biggest opportunities for telehealth are going to be moving forward in healthcare.
Mm-hmm. Well, I've been working in telehealth for a long time, and I remember in the late 90s working at MD Anderson, and we didn't even have a flat panel. It was a cathode ray tube, speaking to doctors in other countries, giving them second opinions at a distance. I thought things would go much faster than they have with telehealth, and a lot of the challenges we've had is not with the technology as much as with how to use it, and most importantly, how to get paid for it. But I think we're starting to get past these issues of how do we get paid. We still have a ways to go, particularly on the federal system around what does Medicare, Medicaid, and the Veterans Administration do in terms of paying for telehealth, and looking more creatively at that. But I think there's a couple of categories that really strike me about the potential there. One is access to care, and particularly for people who are in rural areas or areas where certain specialists are in short supply, or sometimes a doctor or a pharmacist is in short supply. Telehealth really opens up new possibilities for them, so they don't have to travel a long distance. They get access to expertise that wouldn't otherwise be available to them.
You bet.
It's also great, I think, for even in urban areas, for patients to experience this. And I had this experience with one of the Optum company's Doctor on Demand. Actually, before I came to Optum, it was about a year ago. I knew I was coming down with influenza, classic influenza, all the aches and pains, the malaise, the fever. And you can take Tamiflu for that and significantly shorten the illness. I really didn't want to go to an emergency room or even an urgent care center, so I went on Doctor on Demand, and I was interviewed by a doctor who is in Georgia, and she e-prescribed Tamiflu to my local drugstore. I went and fetched it, and the whole experience took 90 minutes from the time I decided I think I want to see a doctor to the time I took my first pill, which is absolutely remarkable, and my out-of-pocket cost was $25.
Are you kidding me?
That's making it about the patient and their experience and making things easier for them. And Kaiser Permanente is certainly one of the organizations that's done well with this. And Bernard Tyson, the CEO, has gone on record as saying, we do over half of our clinical interactions right now with telehealth, and I think he's referring more to the California population. It really helps people get access to care without having to drive, park, take a day out of work, spend an hour in the waiting room, 45 minutes in the exam room, and see the doctor or nurse practitioner for 5 minutes. Instead, go on Skype or whatever way they're doing it and spend those 5 minutes almost real time and have perhaps a change of medication e-prescribed in. It's not appropriate for everything that's wrong with you, but for where it is appropriate, it can really be life-changing. And you can, if you have a kid with asthma, not have them miss a day of school to make a minor change in their medications because they don't have to go to the doctor now. They can blow into a spirometer that's hooked up by Bluetooth to your smartphone, and the doctor or nurse practitioner have all the information they need, and you can take great care of someone that way. So I think we're still just scratching the surface, but it feels like it's finally accelerating.
That's a great point. At the seminar that I just came back from on telehealth, I gave a talk on a different facet of the technology and implementing it into the growth of health systems and hospitals. And that's one area that I think, especially moving from fee-for-service into this new risk-based world of value-based care, a lot of hospitals are on much smaller margins than they used to be, and a number of them are beginning to close or to sell out. I really feel like that moving forward, if health systems, hospitals, providers can start using that virtual care to expand out that service footprint, I think they're going to be able to start reaching and competing for consumers. I mean, they've never had to compete before, but now I really see us in a whole new age where, health systems and hospitals are going to have to start implementing really convenient, real-time need fillers like telehealth, not just for, convenient location and care, but, also to market and capture new health consumers and patients.
Yeah, I think you're absolutely right, and it's one of the things that are differentiating disruptors in the market because, historically you went to see your doctor and that was your doctor. And now you can actually shop around and look at things like outcomes and cost and convenience and including things like their use of technology. And do I get my laboratory results in an email the next day? Do I do telehealth? All those kinds of things are differentiators to advance a practice. And one of the challenges of rural medicine, as we know, is they don't always have access to all of those resources. So it continues to create a gap in certain communities and regions between the haves and the have-nots in terms of access to some of these innovative things.
Yeah, it's interesting. Once you go ahead and get into telehealth and some of the technology that's coming just around the corner, and even speaking to some of the entrepreneurs, I think we were talking earlier about that telehealth seminar that I was at. I wound up meeting in between the sessions a ambulance company owner in Macon, Georgia. Nice guy. And he has the idea to actually start installing telehealth equipment right on his ambulance fleet so that as they're going to the county hospital, they can go ahead and be in contact, the paramedics can be in contact with the doctors right at the ER. So if there's any prep work that has to be done, if there's anything they need to check before they bring the patient in, or just to give the hospital the status while the patient's on the way.
Yeah, that makes total sense. Love the idea.
And now, a message from our host. Red Hot Healthcare was a side hustle that started for me back in January 2017. I'm pleased to have had tens of thousands of downloads and show listeners who are some of the top healthcare leaders and influencers. However, my full-time career focuses on adding tremendous value for healthcare organizations. I'm happiest when filling the needs of those I work for and with. You can learn more by visiting my consulting page at redhothealthcare.com/consulting, or reach out to me directly by emailing steve@redhothealthcare.com. And now, back to the show. So, Mitch, one of the areas that I want to get into next is innovation. And when I look at innovation, I break it down into 4 types: breakthrough innovation, sustaining, disruptive, and then what I would call basis research. I know Optum and Optum Insight invest a tremendous amount of money into research and innovation, but specifically, I'd like to hear from you what type of disruptive or breakthrough innovation that Optum is developing.
Sure. Well, we're trying to move the needle on innovation in several different ways. We know that if we're not continually reinventing ourselves, we're not going to have much of a future. And helping the industry reinvent itself and get back to making healthcare better and simpler for everyone requires innovation. So we spend about $3 billion a year investing in innovation. One of the
Wow.
ways we do that is through Optum Ventures, which was announced in the last few months. And Optum Ventures supports with Series A and B funding early stage companies that are developing transformational capabilities.
Yep.
We invest in Optum Labs, and that is a series of relationships we have with prominent academic medical centers, life sciences companies, and we focus on innovating together, many times using analytics and big data, figuring out how do we change the health system that way in a way that has impact. We have tons of bottoms-up innovation at the company where our employees who have absolutely amazing ideas are encouraged to bring those ideas forward in a series of formalized programs, such as a Shark Tank competition. We have Innovation Week competitions. It's just going on constantly, and we get some great ideas, and some of them we end up investing in and moving forward with. So it really is built into our culture, and we put our money where our mouth is when it comes to innovation. So that's really important. We recently announced Optum IQ, which is putting together a series of analytics products. It involves machine learning and cognitive computing, and we are in the midst of adding in the capabilities around genomics and other exome data, as well as the social determinants of health, which are really, really important.
Yeah, definitely in agreement on that, Mitch. I want to get into a deeper discussion here on something we discussed off air. I believe we're at a point now in our healthcare system and with our health crisis where we've got a really challenging problem, and that is that there is a butting of heads between the business of healthcare and then the needs of our healthcare system. And so when I'm talking about needs, I'm talking mostly about affordability for individual and business consumers, as well as drug customers. So with all that said, we're seeing pushback now from self-insured companies that are looking to directly contract with local health systems. We're seeing more integrated health plans. Amazon is looking to disrupt the drug space, perhaps the PBM space, and there's the advent of direct primary care. So being a veteran of the industry, Mitch, you've worn a lot of different hats in a lot of different places. I'd like to get an idea and have you share with our audience how you see our health system evolving, and specifically how you feel like it may be able to meet the needs of health consumers, particularly in lower, more affordable pricing for healthcare, drugs, and coverage, while still keeping the business side of healthcare strong.
Yeah, it's really difficult to frame the debate around that question sometimes. We started off by talking about how complicated the ecosystem is around health and well-being and healthcare. And sometimes you listen to the debate in the media or in Washington, you go, what are they even talking about? That's not what our real problems are. I mean, we certainly have a problem with access to healthcare in this country that we need to work on. But there's also, as you're saying, a very significant cost problem that we haven't spent that much time, really addressing and working on. I mean, there have been some pilot programs and so forth. And a lot of the cost gets back to incentives and structure and why people do what they do. So I think the transformation that needs to occur is going to happen on multiple fronts. And I wish I had a crystal ball and say which ones will be emphasized and how fast it will happen. But there are so many unpredictable variables that's hard to do. But I'll tell you some of the things that we're focused on around the cost of care is figuring out how do we really encourage alternative sites of care that are less expensive. So people wondered, for example, why we acquired last year Surgical Care Affiliates, SCA, largest surgery center company in the country. And a lot of the reason is they're able to deliver a much lower cost, oftentimes half as much, surgical procedure with better clinical outcomes and higher patient satisfaction. So
Yep.
that's really impressive. And there's all kinds of other things about sites of care. And ultimately, we'd like to get to the site of care being, hey, we're taking care of you at home. You don't even have to go anywhere. You can continue to stay at home, go to school, go to work, and engage in care and health activities without even having to see the doctor. So that's a blend of technology, incentives, new ways of looking at care and prevention. And another big piece of this, besides sites of care, is how we manage chronic disease, because somewhere between 80 and 90% of our federal health expenditure is on the management of chronic disease. And if we could do that more effectively, again, with alternative sites of care, but also really aggressive care management, where we took care of things earlier in the process, lowering the cost to the consumer, lowering the cost to the large employers, increased satisfaction, putting the person really at the center, which we started off talking about earlier, then you've got a lot of success. One of the other areas that we have a focus on, as do many others, is the social determinants of care.
Yes.
And understanding what drives healthy behaviors. And it's not one size that fits all, because there are socioeconomic, cultural, ethnic, regional, all kinds of differences as to why people do some things and don't do others. And understanding those social determinants and being able to work directly with them, not that we're going to change people's culture, but we need to work within their culture to help them achieve the best health that they can, and also at the same time for the lowest cost. Pricing transparency, that's another important thing, and we also touched on that when I went in to get my stress test, and they had no idea how much it was going to cost. People need to know what things cost. So there's lots of areas where, as an industry, we have opportunities to move, and thought-leading pharmaceutical companies that are moving into value-based payment systems where they don't get paid unless the treatment works. So I think we're starting to see more of the private sector drive some of these innovative ways of approaching care. And if that can continue and we can lower costs, then I think we'll all be in a good position.
And I would only add, just to your point on lowering costs, that a lot of people don't recognize, particularly who look at healthcare and don't have a background in either economics or in just understanding the way the industry works from a financial perspective, that healthcare really operates on its own island. In terms of costs, we have a system largely in healthcare which is not a consumeristic market. It doesn't have free market forces that over time there's competition to increased quality and decrease the pricing. One of the things that we hear a lot about is we're going to lower costs, and we hear it from the business side of healthcare, but we don't really hear the flow through of that you would hear in a normal consumer industry.
Right.
We're going to lower costs, and therefore we're going to be able to pass on lower pricing for our consumers. I don't have an issue with healthcare companies being profitable. I just really wish that they would find a way to lower costs, then lower pricing, keep their profit margin, and really be able to start cooling off what's becoming a really overheated and largely unaffordable set of payments for coverage, care, and drugs.
Well, you're absolutely right, and that has been historically a problem. It's still a problem today, but we're starting to see some signs of moving off that. And I could give you some examples. One example is pricing transparency for retail drugs. There's an app that I personally use for the medications I take. You put down the medication, and it tells you near you, because it's got a GPS, knows where you are, all the different retail drugstores, how much it costs, and gives you coupons for it. That's their business model. And remarkably, there can be a tenfold difference in the price of the exact same medication between one pharmacy and another.
Really?
No, and I'm not going to name the names of those pharmacies, but some pretty crazy differences. It puts the control in the hands of the consumer. But I'll give you another example on a larger scale of health systems and payer-provider convergence. And typically payers and providers at loggerheads and don't have warm, fuzzy feelings about each other. And I think that's starting to change as well. And if payers and providers can work effectively together at managing clinical and financial risk, they have an opportunity to drive higher market share, higher volumes, and the financial benefits that come with that, but at the same time, return to consumers and employers a lower premium price for a high value network. So those are some of the things that Optum's also working on. It has to do with putting around technology around the processes so that consumers, payers, and providers all know what they're getting and what they're paying for, and aligning the incentives. There's regulatory challenges, but alignment of incentives, I think, is one of the biggest challenges we have in this country for getting efficient and effective healthcare.
Mitch, I want to jump into another area here, and that's particularly interesting to me. Optum's subsidiary, Optum Care, has made over some time now a large number of acquisitions in the provider space. MedExpress, which is 141 urgent care centers, New West Physicians, there's 120 providers there. There's almost 200 ambulatory surgery centers, and we talked about that before, surgical care affiliates. And then recently, a tentative $1.3 billion purchase of the advisory board, which consults and has connections with about 4,400 healthcare organization clients. So I'd like to know, what's the rationale for the acquisitions? Is it a matter of Optum looking at the entire patient care cycle and just having a hand in all parts of it? Is Optum seeing a change in the market where there's a shift to providers getting a lot stronger in their leverage over payers? Maybe you can just fill us in a bit on that.
Well, I think we've been touching on some of the reasons behind this, and it's about making the health system better. And insurance companies aren't going to do it alone. Providers aren't going to do it alone. And consumers they're not empowered to really make a change. So our belief is that if we can bring on physician-led practices, which most of these are, we can work with them to align incentives to lower cost, to get better clinical outcomes, and improve patient satisfaction. And we see that in the surgery centers that we talked about. We see that in the medical practices that we work with. And they're a key to not only working with health systems, but also working with insurers to find a better way to manage clinical and financial risk and have those better outcomes. And then on the advisory board side, we're very excited about that. That transaction has been announced, but not closed yet. And they bring a number of capabilities that we think will be a great addition to Optum, including a lot of thought leadership around research. And I remember going to my first advisory board meeting back when I was on the other side of the fence, and I was one of their members back in the 90s, and this was the first round of managed care, and listening to their insights. Well, they still have amazing insights around the provider space, but it's really also expanding into payer, and we plan to expand it beyond that. So that thought leadership that can help drive the industry in particular directions is very important. They have wonderful analytics tools that are actually very complementary and will fill out our suite, and we plan on investing and continuing to develop those. And then they also have a very strong consulting capability that's primarily focused on providers. And at Optum Advisory, our consulting is in provider, but much more well-developed in payers. And because we believe that payers and providers working together, firing on all cylinders and being very effective is going to be important to achieving our mission. That's why that whole mix of research, analytics, and consulting from advisory board we think will be very helpful.
Yeah, great point. I think I read something recently where there was nearly $6 billion that was going to be spent this year, all-time high, on healthcare consultants. And I'm not sure if that's just for health providers or that's providers or payers, but there's really a lot of uncertainty going on in healthcare now where things might be landing, and companies are looking for more thought leadership to help them out.
There is. And one of the other things, Steve, that we want that consulting group to do is help our clients achieve value. So if you buy some analytics tools or HEDIS and STARS things or a core claim system, how do we make sure that when you're working with Optum that you achieve all the value that you thought you would achieve? And a lot of times that involves managing change, redoing workflow, the kinds of things that consultants really bring to the table. So that's part of it too, is helping the companies we work with do even better because of these additional wraparound services.
Mitch, I want to get into just some recent news about Bernie Sanders coming back into the mix and talking about his single-payer healthcare system that's going to help healthcare for everybody. I know that on the surface of it, a lot of people are hand-clapping and think, well, it's about time. We need to be just like all the other countries around the world and change things up for the better. I'd like to get your thoughts, if I could, and to share with our audience on this Medicare for All single-payer healthcare initiative and what it would mean if it were implemented today.
Well, the devil would be in the details of that. And there was a wonderful piece in the New York Times that compared the single-payer systems in the G20 countries like one-on-one. So it was like, France versus the UK and the UK versus Germany and Germany versus Switzerland, pluses and minuses of each. It was wonderful. What it really highlights is, number one, even though they're all quote unquote single payer, they're all very different. And how they actually deliver care is very different. I was fortunate in my last position at Deloitte to have a global role, and I actually got to work in all these countries that were being analyzed. And they have a lot of the same darn problems we have. The costs are out of control. People wait too long for care. One of the worst things is care is fragmented, so that when you leave the hospital, your primary care doctor likely has no clue that you were even there in the first place. And that's true in many countries. So I think we really need to separate the conversation to issues of access and how do people have care paid for. And of course, I think you used the word free. It's never free, so we'd have to pay for it somehow through taxes.
Yep.
So it has to be paid for somehow. So there's the issue of access. And then how do we deliver care in the most effective way? And we've spent most of this hour talking about that. There's so many complexities of all that. I do think the private sector has a very important role in the healthcare ecosystem. It brings innovation, it brings competition, it brings investment. The government also has a very important role. I think I already said I'm a big believer in public-private partnerships. I think that's the way to go. And I'm not sure what's going to happen, for example, at the state level with Medicaid and whether there'll actually be block grants. But I do think there's an opportunity for states to begin to say, hey, if we had a bucket of money, how would we most effectively spend it to maintain the health of disadvantaged people who live in our state? What would we do differently? I think that the private sector working together with state governments could help figure that out. And we certainly see a lot of that today at the federal level, as well as the federal government in the different manifestations they have of working with health looks to the private commercial sector to figure some of the more innovative things out. If you look at countries that came out high on comparison that I talked about, Germany and Switzerland were very high. While tax funds are used to pay for health care, there are still insurance companies and there are still who have to compete on price and services for enrollees, for members, for patients. And then the private sector delivers the care, and they also have to compete based on it. And they do a very effective job of delivering care for much less money than we spend here in the U.S. So, yes, we've got a lot of problems. The fix ain't easy. And I hope that we see the debate in Washington and state houses elevated to how do we solve the problems of access? How do we have the most effective way of approaching care and bring that to the American people? Because that's the direction we really need to head.
Mitch, I know on the website for Optum, it talks about the fact that the company is connected with healthcare consumers, 115 million empowered consumers, as it reads. I would make the case that that connection is really through a B2B2C fashion. Because Optum is looking to empower consumers, has the company thought about actually creating an outward-facing site?
It's an area under active discussion. That you mean just straight B2C without the other B in the middle?
Yep.
Yes, it's under active consideration. I think we do recognize the importance of that, and at the same time, we also recognize the importance of the relationship between a person and their physician or their group of physicians, and that's not something we necessarily want to get in between. So carefully considering how to do that and how we deliver value is something that is a work in progress, let's put it that way.
Okay, Mitch, as we're coming into the home stretch here, I'm going to go ahead and take a step back and ask you a personal question I'd like to get your thoughts on. If you could recommend one book to our audience, what would it be?
I recently read a book called The Boys in the Boat, and it was about a group of students at the University of Washington back in 1936 who wanted to go to the Olympics, a rowing competition. They had tremendous individual adversity, things went against the group, a lot of things that they had to overcome. And for me, it was very inspirational because it was all about teamwork, about persistence, about being able to be focused on something and how they did it together. I guess that ties in a little bit what we're talking about is solving the challenges that we have are going to take a lot of persistence and focus. We have to be driven towards it, and it's not going to come from one person or one company. We got to work together on it.
Dr. Mitchell Morris, Executive Vice President at Optum Insight. Mitch, I want to thank you for the time you spent with us today. We had a great time, and I know the audience really enjoyed it. Looking forward to having you back on the show, and best wishes for your future.
Thanks, Steve. I really enjoyed it, and enjoy all my conversations with you.
You've been listening to Red Hot Healthcare with Steve Ambrose. Subscribe to us on most major podcast directories. For media or business inquiries, reach out to media@redhothealthcare.com. Thanks for listening. This is Denny Colonna. We're out of here.